Good afternoon. This is Dr. Bill White again with the American Orthodontic Society, and I'm going to talk to you a little bit about a pretty complicated adult orthodontic case. We had to kind of expand the arches on this adult, and then had a lot of space in there that we had to close together and continue to keep the arches expanded. I never could find the final pictures here, but it's an interesting case, and we solved all the problems that we had set out except the expansion where a lateral was missing. Seemed like we couldn't get together on whether to open the space or close the space. But anyway, it's a very interesting case, and we'll go ahead and start it. And I put out here at the bottom of this case is loaded, and it is loaded. And you need to have an orthodontic challenge to do orthodontics like this, but there's a tremendous amount of this type of orthodontics is going untreated, and I feel like that really this should be something that the university trained orthodontists should be trained to teach and to do this type of orthodontics. And you have to kind of mix it with restorative dentistry and endodontics and all sorts of other things, oral surgery and things of this nature. But anyway, let's get on with the case, and I'll try not to spend too much time with it. This is a nice lady, and she's got good facial features. You know, the height of the face in here is not exactly right, but nobody's is, and so anyway, it looks good. Now she looks awful serious here, but she's a very nice woman, and I appreciated her working, and we worked on her for a long time. I don't know whether she may have moved away, but left, but we had the problem solved really when she, the last part that you'll show here. Now this looking at the case, of course we got a deep bite, and half of these cases seem to have a deep bite, and she's got a temporomandibular joint problem. Her jaw cannot come forward. You know, it's locked in back here, and so she's crowding the retrodiscal tissue that forms the fluid here that operates the synovial fluid, which feeds the tissue that's between the condyle and the fossa, that takes a tremendous amount of pressure, and this tissue has no blood vessels, no arteries in it. And how does it get fed? It gets fed by this synovial fluid that is pumped in there and kept around it, and when you press just lightly, it pushes that fluid up into that tissue and feeds it and carries off the waste product. And it's a complicated thing. It functions almost like a kidney. You can write books on the stuff. It's really something that you want to, it's amazing to me. At my age, I've still got that disc or the tissue over the condyle, and my condyles are smooth and they open and close. I got damaged and got a little bit of a problem on one side, but it's still with me, and it is amazing how long it lasts. All right, Now looking here, we've got this deep bite, one central, further down to the other, and of course this missing lateral here that we never could decide to open or close. We could have opened it and put another tooth in that area, or you could have taken this tooth out and brought this forward and had no laterals, or you could just leave it like it is. She's been going that way with it all of her life. So it's possible that you could have just left the thing, and I guess that's the way we did. Now there's some real problems with the spaces, closing these spaces in here. All right, this looks bad. I mean, you got, here's a 6-year molar down here, and here's a second molar up here. And this tooth is over erupted and tilted into this hole, and we've got another tooth back behind here that we're going to have to line those up and close that space. This won't show up until we get to these Panrexes that we have on the case. All right, looking at it here, we're going in and kind of expand the arches and kind of develop them out and make room for all that to come in. Let me see if we wrote on that. Now over here we've got a gap here. We've got a 6-year molar that's out here, and this is crowded as all get out right in this area. So we're gonna expand this and bring it back part of the way, move this up for a 6-year molar, and this will be a second molar, and apparently this is a wisdom tooth here, and this is a 12-year molar. The 6-year molar is gone, and then these are 2 bicuspids and a cuspid and the lateral, and it's a kind of a mess over there. Here the molar is gone. See, we've lost that, and so we got to close over on the right side. Okay, I'm going to erase that and we'll go on. Here we started out, it's 1992, and we just put one of these little flexible woven wires in there, and we opened the bite somewhere or another here, because these teeth we've already gone some, but these teeth were way down here when we started out, and so we've had a little time with the case. Now when we look at it here from the side, you wonder, what on the earth? Here is the second molar, and here's the first molar down here, there's the second molar up there. That doesn't make good sense there, and we're unraveling this part right here, filling this gap and closing the other up as you went along. And similar thing on the others, on the right side of the mouth, we're lining up these 2 teeth, and I'm going to show you a little bit about that in a few minutes here. This is a bad picture, but it shows how crowded these teeth are here, and we're moving them into that space. Sorry to have to show that, but back then when you sent them off, that's all you got. If you either that or nothing, and so anyway, we used it and just put it in there. Okay, here on this side, it looks pretty simple, except it's class 2, you see. So really this molar here needs to be something. That would come in, it would come out the lower molars kind of right like here on this, and now it's back there. So this is the 6-year molar is gone, and we're bringing this second molar in, and we need to correct the class 2 problem. I don't know that we get all these goodies done in one fell swoop here or not. Alright, this is 1991. Alright, we've jumped up to 93 here, and we put an intruding arch in here, and we're leveling this out now, and we've got a rectangular arch up above, and I think we had planned to just keep this tooth, keep the space, just close it up and forget it, but I'm sure later we show it kind of opened up. Alright, there's the way the bite was. You see, this tooth is down here, just a little bit of the permanent teeth that you see at that point, and here we're this far. So we've opened it up and leveled and got the two teeth going about the same way. Now this side over here is a little more of a challenge. This tooth, the 6-year molar, is erupted further than it should. With this one being gone, it's down here. Now the second molar back here is leaned over, which pushed this part up, and this one's occluded against it. It's way up there where it should be way down here, you know, so both of them really ought to be lined up. And then this second molar here with nothing above it has just gone up and is contacting the gum tissue up above. So this, what you want to do here is get these two teeth lined up together in a line like that, and then you come in here and put one of these little spring-like things going this way. Now this wire coming off of here, you do this, you bring it up and attach it to that, and that brings these teeth down and lines them up with the rest of it, and you pull from here against the second molar back here and close the space in there. Now this thing is put where the two lines come together right there. That may be confusing to you, but you watch it, how it works out over here. Alright, here we've done a lot of that, and we're closing the space on it, and we have an intruding wire in addition to the regular arch wire that's on that side. And this is the way the upper is. Now we're going to expand the arches, of course, in here. This lady's 52 or 3 or 4. I think she's 55 before we got through with this. But look at the size of the arch. Now, people that say you can't expand adults, we expand just darn near everybody we get hold of. We seem like we need to expand and develop their arches, and they hold up. You put a retainer in there, they stay, and get them functioning right, and have the tongue going up in there and pressing out on the sides of the tissue up here, and this thing stays with you pretty good. Now if you don't get them functioning correctly, you've got a real retention problem. Alright, let's see that again. Now look at this good, and then look at the different sizes of it, you see. And these teeth are lined up in here, and here they're crowded up in here, this area. Okay. Now on the bottom, the same. See, this is a cluttered up bunch here, and we're going to use part of this space to bring these teeth back. Now watch this move here. I'm going to click to the next deal, and you see where those teeth are, and go back here, and so the gap is down to this size right here. Of course, this has come forward some, and we've got these teeth together back here, and we've got that little deal in here, and this wire is going off down in that direction, and it's pulling forward on this is bringing both teeth together in the same kind of plane as you pull forward in there. Okay, here is the cephalometric. It's got a pretty good airway and everything in there, and she's got a fairly normal functioning bite. The lady is 52, almost 53 years old, and this is apparently when we started the case. And you can see these molars. It's in a mess, and she's got her jaw is kind of locked back here, and so she's having some discomfort back here with the condyle pressing on that retrodiscal tissue and giving it a hard time. So you open it up and you bring the jaw forward, and it gets this condyle off of that tissue back in the back. Apparently that's what happens. Anyway, it gets over it. And we never take a transcranial x-ray unless somebody's got a joint problem. And if you haven't done this, you can see the condyle pretty plain in here. And then you pick it up again over, and this is the fossa. And the condyle, boy, have a job seeing it myself in this one, but there'll be a condyle in here, some right in this there area, and you look down on the bottom, and of course this one will be going in this direction, and this one in this direction, and we opened it up and freed that, and that was all that was necessary to correct the jaw joint problem in here. So we did correct that problem too. All right, looking at this, it might scare you off at first to see how in the dickens are we going to get this tooth down and forward and under that tooth, you see. Now the thing is to get these two teeth lined up right in here, and you've got your archwire be coming back in here, and where they meet you make this little circle like that. You go down, make this circle, and then this part of it goes off this way. Now you spring it up and put it on that, and you pull forward from this, and you get these teeth together the same way over here. These two teeth have to be together, and then you bring the archwire back in here. Now sometimes you have to drop this thing to get this lined up in here. Now this tail end will be going here, and you bring it up, so it's pulling down this way, and you're pulling on it in this fashion. Now watch these roots come forward. However, we did not get the roots in the last picture that I've got on it, and I searched and tried to find other stuff on it, and it's been about 26 or 7 years since we did this case, and I'm not able to come up with that. Now you'll see this. Now you see at this time, there's some time passed in here. This was 10/31 of 91, and this is 92. So it is had some time. Now this is that little spring right here. It comes over here, but the tail end of this thing will go like that. This was behind this, and it goes down in here. So you bring this up, and then you try to close, and this space won't touch there, but these roots will move in a forward direction with that type of wire in there. And you see the difference in this right here. And we had a bite plate, apparently a removable bite plate in her mouth to open it up for us to get this tooth down here under that. And once we got that, we'll line this up. But look at the difference in the teeth there. Now, I'm going to erase this, and I'm going to back up. Now, look at the difference in here. I mean, this tooth is up against that. Of course, we're down in the space in here. We're going to be going back, because a lot of that space is closed up. Let's see how much of it. You see how much that space is reduced right here. This is cut way down. If you go back here, look where it was to start with, you see. And these teeth are different. They're now lined up pretty well. See there? Now, you would think that this is just an extremely difficult thing to do, but when you've got two teeth like that, try to get them lined up going this way. Then you come right into this area, and you drop down, and you make a little deal like that, and you come off. Then the tail end of this, and if you pull this up, it tightens this spring, you see. And this is trying hard to bring these teeth this way, and you're pulling on them, which is bringing the crown forward, but this has power over that, so you're pulling the roots forward, and you're not closing this as fast. And the same thing on the other side, you see. Now, let's go another time, and you see we've just about leveled this thing out. You see that little deal right there? This is down. You can see this one over here too. And so that's the secret of bringing those teeth. Just line the two molars up and just work with them, and you can have that little spring doing this work. And this is 93 here. Now, this is not orthodontics for a beginner, and I'm not suggesting this, and it would have been very simple for me to have brought these teeth back and opened the space for a lateral. But apparently the lady either decided she didn't want to pay for an implant or a bridge or whatever was going to take to fill that up. So apparently, as we finish, we look like we're closing the space. And maybe we did. I can't remember exactly what I did. That's part of old age. You get your forgetter gets better. That's one of the few things that improves. But it looks like we started to open it, and then in the next Panorex, it's closed again. All right, here we're closing it up, and we've still got a lot of work to do here. We need to bring these roots up here, but this opened up good in this area. This needs to be picked up and lined up. There's some more work to do here, but somewhere or another I couldn't find it. I tried to search it in any thing that we had stored away somewhere, but I have lost the finishing of this case, and I'm sorry, but there's a lot to learn going from where we were to where we came here. So we got rid of the TMJ problem. We could have gotten rid of this problem right here, and this is pretty well done. In other words, I can finish this out and bring these roots up a little bit more, flatten this out, and the case is pretty well done. Now, if she left and went to somebody else, they'd have a hard time figuring out how it got to this point. But anyway, that's the end of it. and I appreciate your watching. And I'm sorry I don't have the beautiful finish like we did on some of them, but anyway, we got rid of most all the problems, and this finishing it from here would not be a big deal. So thank you for watching, and join our group and subscribe to this, and I'm gonna try to do these videos as long as I can and pass whatever is interesting to people on to them to learn to do. So I'm gonna have to get over here and close this up. So I'll say goodbye for the time.